Hi everyone, my name is Dr. Eze Nnamdi Charles of Amazing Physiotherapy. Have you wondered why you see lots of elderly parents very reluctant to walk because of an associated complaint of pain running down the back of their thigh with lots of cramps, aches and discomfort getting down to their calf and even to their feet? You may be wondering why it restricts their mobility and restricts their ability to walk considerable distance without waiting to rest on several occasions. Today, I want to talk about spinal stenosis and exercises you can do to relieve symptoms associated with it. So today I want to talk about why we have this spinal stenosis and what exactly spinal stenosis is all about. We have seen lots of different diagnoses at different points for lots of back related issues and pain and discomfort, some of which might be a disc bulge, some of which might be a disc herniation, and now we want to talk about spinal stenosis. What really happens with spinal stenosis is the degenerative changes and narrowing of the exit nerve roots, causing irritations and some degree of compression around the neurovascular bundles that sends the sensations down to the back of your legs, leading you to having cramps, aches and discomfort. And a successful treatment for this kind of intervention is how much space can you relieve so you can have a degree of relief, so you don't avoid relying on painkillers, injections, or have to do a surgery. Spinal stenosis occurs in about people who are age 60 and above, and it's considerable in people who are of higher age. Now, looking at the exercises that help you to get rid of some of these discomforts, we might likely consider exercises in sitting, exercises in standing, exercises in lying down. And some of these exercises are, you might consider lying on the floor. It is important you perform these exercises while lying down. Now, the first exercise we encourage you to do to relieve symptoms of spinal stenosis is what we call knee to chest. So you might draw your knees close to your chest and hold for a considerable amount of time, let's say between 15 to 20 seconds. You might consider to hold this position for longer if that persists, depending on your comfort level and even the size of the stomach. When you drop this leg, you go on the other leg. You hold for a considerable amount of seconds too, between 15 to 20 seconds, then you rest. The second exercise you might consider doing for this condition is lifting both legs close to your chest. Then you hold for a considerable amount of time, between 15 to 20 seconds, bring down. Repeat this procedure for about 3 to 5 seconds. Now, the next exercise you might want to do is what we call lumbar rotation. You try to move your legs to the side. You move them to the side of comfort. You might consider moving this one to the side of comfort too. Then you might, so when you do this, you feel some level of stretch around this area. You move them to the side of comfort too. You hold for a couple of seconds. That will be of a considerable benefit to you. Now, another exercise you might consider doing for this condition is you may consider getting a chair for this purpose. And the essence of this using the chair, it's you get to sit on the chair. Then the first exercise you might want to do is you roll your leg on the opposite leg. Then you hold for a couple of seconds. You might want to make it a little bit more, achieve more stretch by trying to lean yourself forward. The reasons why you have to lean yourself forward is Flexion, more like bending forward, benefits a lot of people with these symptoms, because you could have situations whereby when they attempt to stand and walk, there is an increased symptoms, and when they sit down and even fold themselves forward, the symptoms considerably reduce. So you can roll yourself forward like this and hold for a couple of seconds, then you relax. You stretch the opposite leg. You also pull yourself forward for a couple of seconds too, then you relax. You hold for a couple of seconds too, then you relax. Now the next exercise you might want to do is, you should open your legs up. Once you open your leg in this manner, you try to reach down to the floor. So on attempt to reach down the floor, you are going to place your back in the flexion manner, more like creating more space and leaving the neurovascular bodies to at least get a little bit of breath, so they are not irritated as they should be. Then a considerable amount of doing the rotation over time might create that much needed space that will give you the much needed relief. Now the next thing you might want to do for this exercise is, you can position the chair in this way, because it's always very important to stretch the calf and the hamstrings. So when you do this, you should look for a very comfortable place, because most times it's the elderly. They should support themselves properly, either on the wall or another chair, so you don't have issues with maintaining balance. Once you're able to support yourself on the wall, you can reach forward. Hold for a considerable amount of time. You should feel some stretch, decent stretch in the calf and in the hamstrings. Then you relax. It's also very important to repeat this process on both legs. Now the next exercise you may want to do is, you drop your legs this way, because we want to get some level of stretch around the hip flexors. Then you push yourself forward. So when you do that, you feel some stretch in the forward thigh. So when you push in the anterior thigh, you feel some stretch. Then what that stretch does is, it works on those tighter hip flexors that you acquire because of long time sitting. So when you do this, you get some good level of stretch too. Then when you repeat on the other leg too, this is what it looks like. Then you push forward. This is the area of stretch. Because we consider this happening in the elderly population, we always advise they hold on an area, because for extra stability and balance. Then you push forward, then you relax. So some of these exercises have shown to be very beneficial for the purpose of releasing symptoms and pains for people who have issues with spinal stenosis. Another exercise we may want to advise you to do is walking. Now when you want to walk, the essence of walking might be difficult at first, but with consistent and persistent walking, you gradually improve your distance. And with improving your distance, you will discover that because I'm able to walk 10 meters today, and without resting, I improve to 15 meters tomorrow, I improve to 20 meters. That is how you keep building on your walking distance. Should this video make sense to you, comment below. If subscribe to our YouTube channel, and also click on the notification button so you become the first to get our videos, because we upload every day. I want you to share this video to your friends and family, and most importantly, make it a great day. Thank you for your time.